by Los Angeles County as part of its COVID-19 Ethnic Media Communications Initiative. I'm Pilar Marrero, Associate Editor of Ethnic Media Services. This is the 6th of 7 briefings the county is hosting to identify urgent problems related to the pandemic and what the county is doing to help people deal with them. Over the last 2 weeks, these briefings have addressed issues dealing with hate, food insecurity, access to healthcare, loss of jobs and income, housing issues, small business, and essential workers. It has been an amazing opportunity to learn about county programs and resources and the people delivering them. As someone who has been reporting in LA and on LA for more than 20 years, much of this is important information and new information for me. So this is wonderful to share with our ethnic media partners. Next week, we will send our media colleagues a formal list of all the speakers and their contact information. And they can be a valuable resource for all of us in the future when we are reporting on the resources that the county has and the needs of our communities. Today, we return to the most critical challenge of the pandemic, ensuring all Angelenos have access to healthcare, including mental health care, regardless of who they are and what their immigration status is. Let me go through the speakers quickly before we start. Our speakers include Anna Gorman, who directs communications for the Department of Public Health, and for years was a fellow journalist working for Kaiser Health News. Mrs. Gorman will update us on the pandemic in LA and the role that My Health LA has in meeting the needs of the most vulnerable residents, those who have no other insurance. Our second speaker is Miriam Brown, Deputy Director of the Department of Mental Health, who will discuss the pandemic impact on county residents' mental health, including, unfortunately, a rise in suicides, and how the county is addressing this. Our third speaker is Sherry Cheatham with the Department of Public Social Services, who is Chief of Medical and In-Home Supportive Services. Remember, colleagues, to enter your questions for each presenter in the chat. We will have a chance to ask questions after each presenter speaks, and we will devote time for that. Also, because we know this is a very intense and very popular topic, we have earmarked more time for Q&A in this briefing. So fire up your questions now. We will send the video for today's briefings to all attendees later this afternoon, along with all the collateral information, including a who's who of each speaker. Next week on Monday, December 21st, we will have our 7th and final briefing. And the subject will be on all issues relating to people's immigration status, where and how immigrants can get county support during the pandemic. So thank you everyone for being with us through this whole process. And now we will begin. Also, bear in mind we have interpreters. Thanks to them, and remember to speak slowly for the interpreters can do their job. Thank you so much. And now we'll just move on to Anna Gorman, Director of Community Partnerships and Programs for the LA County Department of Health Services. Anna, the stage is yours. Go ahead.
Thank you so much. Thank you for having me. Yes, I spent 20 years as a reporter, 15 years at the Los Angeles Times, and 5 years at Kaiser Health News, where I wrote about health for NPR, Washington Post, and maybe some of your publications. Often our stories would get translated into the other languages and printed in ethnic media. So I wanted to just give a very brief overview of where we are in the pandemic. I am not a physician, but I will just kind of tell you what the messaging is, what we've been hearing from my director, who I just got off the phone with, Dr. Galley. And then I want to just talk a little bit about My Health LA, which is the program that I run. So you all may have heard yesterday in Dr. Galley's presentation, her briefing, where we are. We are in the middle of the worst surge. Record numbers of COVID patients. Today, we have 336 COVID patients at our hospitals, and we, again, are below 100 ICU beds. Hospital admissions doubled in the past few weeks, and across all hospitals in LA County, we still have available beds, but only 66 available ICU beds and only 346 total beds. And same thing among our 4 DHS hospitals, we only have 18 available ICU beds. So my colleagues have been talking for the past few days about that this is really an untenable situation. I mean, this is what it looks like. Long waits in the ER, long waits to get offloaded from an ambulance, redeployed nurses, new areas for treating patients, record deaths, dwindling numbers of staffed ICU beds, canceled surgeries. I mean, to me, each and every one of these could make for an interesting story, especially the kind of nurse staffing issues. All these hospitals are asking for waivers from the state to be able to operate out of, to work out of ratio. We're talking about something called team-based nursing. So those are really interesting stories. The other big story, of course, is the vaccine. LA County Department of Health Services is going to vaccinate 6,000 people in our workforce alone by Christmas, and 10,000 as we get the second shipment in, 10,000 people by the end of the year. We have a press briefing tomorrow with Dr. Galley, with Supervisor Solis, and with our head of our vaccination effort. And so I hope you guys got the information about that. Otherwise, I can send that along. And we are really, really, oh, and also my colleagues at the Department of Public Health are holding a town hall tonight about the vaccine in general. We have not started messaging or talking about the vaccine for the public or our patients yet, but it's coming soon. We also are really, really encouraging people to get the word out to your communities, and you guys play a critical role in that, to tell people to stay home for the holidays and to really not go out unless they have to. Also, if you are not having an emergency, don't go to the emergency room. So emergency rooms are for emergencies. Always have been, but it's really, really critical now. We have people showing up who are not that could get care elsewhere in other settings, or from the COVID advice line, or from their primary care provider by phone. So those are some of the messaging that just keep thinking about. And then testing, we still have our 180 plus testing sites around the county. We started an at-home testing collection for the holidays. There was a press release a few weeks ago, really good story. You can get your testing kit mailed to your home. And also we're starting mobile testing. So kind of like pop-up mobile sites, including up in the Antelope Valley, if anybody is located up there. Okay, so that's kind of an overview of where we are in the department. I wanna share my screen because I wanna give you just a quick overview of My Health LA. So my role at the department, I'm actually an interim communications director, but my normal role is I run a bunch of community partner programs. I help with connecting our patients to resources. So this is also another story, I think, that we screen our patients for food insecurity, housing insecurity, and other issues, and then we connect them with resources with something called 1 Degree. onedegree.org, the number 1degree.org. And it's like a community platform. We're rolling it out across the department, and soon we're going to take it out to the community. I also oversee a program called Medical Legal Partnership, which would love to get more coverage of. We put lawyers in health clinics to help people with their legal issues that affect their health, like domestic violence, housing, evictions, benefits problems. So the lawyers actually work very closely with the doctors, and they help patients deal with legal issues so that they can be healthier. Okay, but My Health LA. So you guys may have already heard about My Health LA, I hope. I'm just going to give you like a 2-minute overview of the program and then talk a little bit about a few interesting things about it. It's a primary care program. It fills this gap. So after the Affordable Care Act, there's one population that didn't get covered. If I were in the room with you, I would ask you to raise your hand if you know what it is. If you want to type it into the chat, that's great. But there's one population that didn't get covered, and that's the undocumented population. We do not ask for documentation status. We do not ask their immigration status, but we know that our folks, our participants, do not qualify for Medi-Cal. So it's not health insurance, but these are people who are eligible. Anybody who is uninsured and not eligible for public insurance, they live in LA County, they're 26 and older, and they're low income. All the kids are already on Medi-Cal, so we don't need to cover them. The breakdown is primarily Spanish speakers. We do have, Asian populations, African American populations, but and other kind of smaller groups, right? But it's predominantly Latinos, Spanish-speaking Latinos. And we pay the community clinics to take care of our patients. So there's 52 agencies, places you have heard of: St. John's Well Child and Family Center, Venice Family Clinic, Queens Care, Altamed, big and small clinics that take care of our patients. And those are the patient's medical homes. That's where the patients go for care for 12 months. And then they can switch if they want when they re-enroll. They enroll at their clinics. They do not have to give their immigration status. Like I said, we don't ask. And they get a little card, like an insurance type card, even though it's not an insurance program. They can't go to Cedars-Sinai or other places for hospital care, right? They are within our system, our network. And they get a variety of things: basic labs, medications, primary care, dental care, emergency care if they need it, or specialty care at the Department of Health Services, mental health care, substance abuse treatment through our partners at the Department of Public Health, and mental health care through our partners at the Department of Mental Health. Here's our website. I encourage you, if you want to learn more about the program in general, to go there. And here's these new cute flyers we did in English and Spanish to raise awareness about the program at the clinics. Okay, so that's like the big picture overview of the program, but I want to talk just about a couple of things related to it. During the pandemic, to me, a program like this is essential. Like, we are, as a department and as a society, need to make sure that people are covered during the pandemic, so that when and if they have health issues, that they have somewhere to go. Our enrollment has dropped somewhat last year because of public charge and because the young adults became eligible for full scope insurance, Medi-Cal. So we lost some there. We've also had some enrollment drop this year because people aren't renewing in their coverage. They're not going into the clinic as much. It's just maybe not on their mind as much. We have made some changes to the program because of the pandemic. People can, instead of showing up at the clinic for enrollment, they can actually call and do enrollment or renewal or re-enrollment by phone. And also, the clinics are seeing a ton of their patients by phone. And the clinics have dealt with lots of challenges because of the pandemic. They've lost staff. They have had COVID outbreaks, et cetera. So we work very closely with them. We also started a texting campaign for the first time ever to text our patients and our participants about really, really important messaging on COVID safety and community resources. We wanted them to know what they need to do to stay safe. So we rolled that out over a course of a few months, and how to connect people with financial help, food help, everything they might need with our other county departments. Lots of our community clinics in My Health LA are also doing testing, COVID testing. We helped them get started so that people can go. It's one-stop shop. They don't have to go to Dodger Stadium, and they could go to their clinic and get testing at their clinic site. We all have a few worries. We're worried about people avoiding care because of the pandemic, and also still remnants of last year and the year before and so forth with immigration fears. Of course, we're going to have a new president, but there's been a culture of fear and because of immigration policies and practices under President Trump, and our patients have been impacted. And then the last thing I'll say before I hand it over to Miriam Brown, because I know she has a hard stop, and then we can maybe come back to me for questions. But I'll leave Pilar to let us know. The last thing I say is I think one of the best stories about My Health LA, in addition to just the program itself being critical during this pandemic and during this time, like that would be a great story in and of itself. But I think one of the best stories about My Health LA right now is this mental health program that we are doing with the Department of Mental Health. They gave us $5 million or they're paying $5 million to us to pay the community clinics to provide mental health prevention services. This is like coping skills, stress management, dealing with grief and loss. And we've trained, the Department of Mental Health has trained staff at the clinics so that people don't have to go and get referred out necessarily. They can get their mental health prevention services right there at their clinic. It reduces the stigma. Anyway, we're really excited about it. We rolled it out in July, and it could not have come at a better time because there is so much stress. These families are dealing with job losses, homelessness, stress, loss of death, right? Family members dying in the pandemic. So these sort of skills and coping skills are really essential. So I would be glad to talk to you all more about any part of anything that I work on here at the department. And I will stop there. Yeah. Thank you.
Thank you so much. And we will allow questions later in the program because we have to go to our second speaker. And now let's go to Miriam Brown. She's Deputy Director of the Department of Mental Health. Hi, Miriam. You can unmute yourself.
Okay. Thank you. Sorry about that. Good afternoon, everyone. A pleasure to be with all and each one of you in this important topic. I not really covered a lot of the mental health, where they can get mental health, especially for our immigrants. So what I'm going to do, I work here with the Department of Mental Health. I'm the Deputy Director for the Emergency Outreach and Triage Division. And basically, I am responsible for providing crisis services in the community. And even with COVID, we are able to go out in the community, taking all the precautions to make sure individuals are getting the proper services, which has been key during this period of time because a lot of individuals have lost contact for whatever reason with their therapist, with their provider, or they're afraid to go anywhere just to get the services. So the Department of Mental Health has really worked very, very closely with all our clients through the different systems to make sure they get services. So we do provide services in person, limited, of course, because of COVID-19. We do provide services through telemental health and the field services, which is the psychiatric mobile response or the co-response model that we have with law enforcement for those individuals who appear to be more combative and may need additional support from police. But the primary work in the field is through the psychiatric mobile response team, which is a behavioral team that goes around the field, does a lot of, gathers a lot of information through the telephone in order to minimize the contact in the community to avoid any type of exposure, not only for the family, but for the clinicians as well. In addition to that, we have the access line. The access line, which is 1-800-854-7771. Through that line, through this COVID period, we have implemented the helpline, the employee wellbeing line, and the veterans line. So a lot of people can just have access. Even if they speak with their therapist, with the mental health provider, they can also call 24 hours a day, 7 days a week to speak with someone. We have a large population of veterans that are in really high need, so they're able to reach anybody at any given time through our access line and through one of our lines to get services to speak with somebody that have similar experience to them. Similarly, we have the line for our employees and other services for our employees because COVID-19, as Anna spoke very eloquently, the impact that it has had in the community. It is a global pandemic, national and locally to us in LA, we're at the worst of COVID-19 or the pandemic, with the number of people that have been exposed, number of people that are positive, and the resources. It truly has a great impact. So what is the impact of COVID in mental health? Mental health is one of the greatest assets that we all have. Unfortunately, oftentimes we primarily focus on our physical component. For example, if we have a headache, if we have a medical condition, we immediately seek assistance because we know that it has to be taken care of. And once we seek assistance, then the problem it's addressed, hopefully resolved. But what we have seen, an increase in individuals that are calling our line expressing that they feel like they want to die. And it's really hard because we don't have any data in terms of complete suicides. As of now, we're hoping to get some data in the near future. If it has increased, what we have not, it's that what we know, it's that the number of calls, the number of individuals thinking about death, it's increased. Some of the things that we know that they have increased, it's individuals experiencing depression, anxiety, fears, lack of insight, and really finding themselves in a crisis because they're having difficulties connecting with others. This impact has really, the impact of COVID, it's not only at a professional level, but it's also at a personal level, because we all have to, at this point, we all experience handling multiple things at all times. Again, not only at work, but also at home. For those individuals who have children and who are in distant learning, children are really trying to cope with a new way of living, not interacting with their friends, with the kids their age, and being in the house at 24/7. Parents trying to learn how to become teachers, how to teach, how to assist their kids. All of that causes a great deal of stress that oftentimes people are not able to identify what's going on. That's where mental health comes into place. We have had a lot of advertisements about mental health billboards with our 800 number. We offer services in all the threshold languages in LA County, and people are welcome to call at any given time and request services. There's also an increase in individuals using substances just to kind of deal with what they're going through, not really knowing that there is other alternatives, or that the problem that they're having is that their mental health has been impacted. Why in our communities, oftentimes mental health is seen as a stigma. Mental health, it's seen as a problem that if you say you have a problem with mental health, it's really not addressed as easily as the physical component. So I will advise everyone to really start talking more about mental health. Without our mental health, we really cannot concentrate, we cannot focus, we cannot function with our kids, with our families, we cannot function at work. And some of the symptoms that we can begin to recognize, it's when we're irritable, or we're feeling down, and it's a constant, we're not sleeping well. We're having, some fears that we didn't have before. The fear of something is going to happen, but we don't know what it is. If you are looking for other ways to deal with your stress, such as eating more or sleeping more, or drinking, all those are symptoms of our mental health. And we're trying to cope with mental health in the best way possible. However, there's individuals out there that are not able to seek the assistance, or not familiar with what's available to them. So I really will encourage everyone to look for the services. Again, mental health provides outpatient services, face-to-face, in all the threshold languages in LA County. We don't ask for insurance. We don't ask for immigration status. We provide services to anyone that comes to our doors. If they don't want to come to our clinics or seek services in person, they can call our 800 number, where they can speak with someone. They don't have to release their name. They don't have to provide any identifying data, but just ask to speak with somebody.
Ms. Brown, would you take some questions before you go?
Sure.
Okay, so let's see. I'm going to ask you a question because I think this is very important. Do you have any providers in your hotlines or somewhere specializing in mental health issues for kids?
Yes, we do. We have providers for all ages.
Oh, wonderful. So in the same hotline that you refer to?
Yes.
Okay. Okay. And then obviously we are going through the major crisis right now, the worst moment of the pandemic right here in LA County. The mess, you know, things could get worse. So how are you getting ready to increase your response?
You know, we have been working very, very, you know, tireless, endless to really be available for the community. We have implemented new methods, a lot of phone availability, not necessarily in person, but a lot of phone, a lot of telemental health, a lot of new ways to do business during this period of time. Traditionally, it's face-to-face, but we have learned that there's other methods, and we have been successful about that.
Finally, and I think we're running out of time with you, what are your biggest concerns? I mean, from what you know, what you've seen in the mental health issues that you are getting to your hotlines that are being reported, what is your biggest concern right now?
The biggest concern is that not a lot of people, we're getting a lot of calls, but not everybody is seeking for help. I would say that one of the major concerns for me, it would be children. We have seen a decrease in terms of calls regarding children, simply because there was a connection with the schools. The schools were, you know, able to identify when children had some issues or they were concerned. Now it's everything through Zoom, like we're here today. And there's been a change in that, and we're not sure what's going on. Are they able to identify that through the Zoom or the distant learning? Are parents looking for assistance or not? And also the parents.
Okay. We still have a couple of minutes. So let's see if we have something in the chat. Okay. All right. In talking, you know, people are talking in the chat about whether or not the county is going to launch a vaccine educational campaign. Of course, we know that the county is preparing that. Are people calling with concerns about the vaccine?
You know, as of now, what we have heard, some people have concerns. Some people would like to have additional information. I know I read some of the reports, and there is some communities that are pretty hesitant, especially with our ethnic communities, about the vaccine, that they would like to have additional information. My recommendation to everyone is really to discuss the pros and the cons with the providers. Know your health, know what, you know, what you're, and have a, when you go to your provider, have a list of questions that you want to ask.
Yeah.
Because if we go there and we're trying to remember everything, oftentimes we forget more than half of the things that we want to ask.
Correct.
So with your provider, be informed about your own health, the risks. Everything has a risk, but I would say that there is a lot of valuable benefits with the vaccine.
Ms. Brown, thank you so much. I know you have to leave us because you have another event. Thank you so much for all the information you've shared with us.
Thank you, and I apologize for leaving, but I do. So I thank you, everyone. Thanks for doing this, and happy holidays to everyone.
Same to you. Thank you.
Thank you.
Thank you. Okay, guys, so we're going to move ahead and go to our third speaker, and then we're going to take questions, or we're going to make questions for our two remaining speakers. So we have third, but last but not least, Sherry Cheatham. She's Chief of Medical and In-Home Supporting Services Program for the Department of Public Social Services. Thank you so much, Ms. Cheatham.
Hello, and thank you, Pilar. And As Pilar said, I'm with the Department of Public Social Services, and on behalf of our department and our director, Antonio Jimenez, I want to thank the ethnic media for putting together these series of roundtable discussions and sharing this important information with everyone. And to the media partners, thank you, because you're the ones who are pushing out this information to people who would otherwise not have it. So as some of you may know, DPSS serves as a major safety net for our county's most vulnerable residents. Our department administers federal, state, and county funded programs for people in need of healthcare coverage, nutritional benefits, cash benefits, and helping people prepare for and find employment. We provide these services to more than 3.7 million people who live in LA County, and that includes over 1.1 million children. We're the county's largest public social services department, and we're the county's third largest department. Right now, we understand that families who were struggling prior to the pandemic have been hit especially hard. So helping them with their needs, like healthcare coverage, has become really critical. Medi-Cal is the name of the federally funded Medicaid program that operates in California. Medi-Cal provides healthcare coverage to families and individuals with limited income and resources. Now, in other words, that really just means that this Medi-Cal offers free or low-cost healthcare coverage to those who are unable to afford the cost of medical care. As of November, we have provided healthcare access to over 3.2 million county residents. This is Medi-Cal alone, not our other benefits and services. It's Medi-Cal alone. Medi-Cal benefits include outpatient services, emergency services, hospitalization, maternity and newborn care, preventative and wellness care, chronic disease management, mental health and substance use disorder services, prescription services, and dental services. Qualified immigrants such as legal permanent residents may be eligible for full scope Medi-Cal. Our undocumented immigrant population may be eligible to restricted scope or limited scope Medi-Cal benefits. And some recent changes brought about by Senate bill changes allow for the provision of full scope Medi-Cal to a certain population regardless of immigration status. And those are all children under the age of 19 and young adults aged 19 to 25. Now, because of the pandemic, we realized that there are a record number of people who have become unemployed or have had their wages decreased because of working less hours. And because of this, they may have lost their healthcare coverage from their employers. Medi-Cal may be an option that they never considered before now. And although our department has been around for decades, we can't assume that everyone knows what we offer or how to connect with us. So we've expanded our outreach and marketing efforts. We have bus shelter ads throughout the county, letting residents know of the availability of Medi-Cal for health coverage needs and how to connect with us. We've partnered with the city of LA to place signage at the COVID testing sites with information how DPSS can help with health coverage needs. And we push out information on our social media platforms of what's available, what's upcoming, and what may have changed. I encourage you to follow us on our social media pages if you don't already. We push out, like I said, timely and updated information on the programs and services we have and our hours of operation. We're looking for all ways of letting the community know that we're here for them. Now, as a safety measure and as a result of the pandemic, we've had to close the doors of our brick and mortar offices. But our incredible staff remain committed to providing the same level of service via the telephone to our county residents. And to be more available, we've actually extended the hours of our customer service call centers. We're open Monday through Friday, 7:30 a.m. to 7:30 p.m. And now we're open on Saturdays from 8 a.m. to 4:30 p.m. If the callers call, they can get information about all of our programs. They can apply for benefits over the phone. And with the executive orders that have been signed by our governor, a lot of the documentation that they would have otherwise had to bring to us in person or mail to us, we can take it or accept it over the phone or accept an affidavit. Our call agents speak up to 10 languages, and they're able to provide an assistance in other languages by the use of a language landline. So residents can call us 24 hours a day, 7 days a week, folks can apply 24 hours a day by visiting our website at dpss.lacounty.gov. Again, we want to let the community know that we're here for them and we're committed to helping them. And I encourage all of you to stay connected with us. Invite us back to these calls, to these roundtables, and we will continue to share information. Thank you very much.
Thank you so much, Ms. Cheatham. We have some questions for you. First of all, let me ask you, what is less known about Medi-Cal? Is there something that people don't know that you want them to know?
That Medi-Cal is one program name, but there are many programs within that umbrella, under that umbrella, that folks may qualify for. And for example, you may not be eligible to one of our other cash benefit programs because you're receiving SSI, but there's portions of Medi-Cal that you may qualify for, even though you're getting Part A and Part B of Medicare. So don't assume that you may not qualify. Apply. There are many available options that are open. We just need you to apply, and we'll walk through them with you so we can find a program that meets your needs.
I'm sorry, I muted myself. I was wondering, you also oversee in-home supportive services, which are so key, and also a lot of the people who provide these services are essential workers and are immigrant women, many of them. How is that type of service being affected? I mean, these are services at home. Have they been affected by COVID?
So those that already have providers, they are still providing services unless someone is tested positive for COVID, of course, either the provider or the consumer. So those relationships are still in place. And if someone does become ill, if a consumer needs a backup provider, we have a process in place for that. So they're not left without care. Those that find themselves needing care now, we will take applications over the phone. Our social workers are still going out to the home to do an assessment of their needs. However, we will take as much information over the phone as we can. So when we go to the home, we will be there as little time as possible. Also, if people are nervous about letting us in the home, we can do a virtual assessment. So we still are connecting folks with care, personal care services.
Good to know, good to know. You mentioned that the county has given Medi-Cal access to 3.2 million, I think you said,
yes, people
in the county. Have you seen how has the pandemic affected enrollment?
So we still have thousands of county residents applying for Medi-Cal on a daily basis, monthly basis. But what is different about this pandemic is that you can go directly to a hospital or a clinic. And because of the federal funds made available to the agencies, you may not necessarily need Medi-Cal right off the bat. There's other funding out there that can help with your healthcare needs. Also, for the newly unemployed, they have medical coverage that may go through the COBRA period, so they may not be coming to us right away. It may be taking them time to get to us. But to answer your question, we still see thousands of people applying for Medi-Cal daily and monthly.
Okay. Okay, I want to go to Anna Gorman for a couple of questions. Hi, Anna. You've been talking in the chat with someone about the vaccine and can you tell us when is the county going to start this education campaign regarding the vaccine?
So that is, we don't know because we don't know when the vaccine is going to be available to the public. The department, so you guys know there's two departments. There's the public health department that Dr. Ferrer leads, and then there is the Department of Health Services, which Dr. Galley leads. The Department of Health Services is the one where I work. We run 4 hospitals, 27 clinics, housing at the Housing for Health program, and reentry population, people leaving the jails. We take care of them as well. Our department will not be leading the vaccine effort. That is our sister department. However, we play a very important role because we have such a large patient population and such a large voice, right, in the county. So we will be part of that campaign every step of the way. Part of, like I said in the chat, the part of the issue is understanding from the community what some of the barriers are. So we're starting focus groups with I think we're working with DPH as well as the Office of Immigrant Affairs to get some information from our communities. Are people scared? Do they want more information? Do they worry about its safety? Do they, do they think it's going to cost, right? Whatever questions they have, because that will influence how we spread the word and how we let people know what's important to know about this vaccine. We are sending out an email today to our patients, just, hey, letting them know the vaccine is coming. So just keep watching for more information. And I know our sister agency, the Department of Public Health, already has a public website about the vaccine. It has FAQs, it has lots of information. So I would encourage all of you to look at that because I think there's stories to tell about how we're going to get over the fear, how we're going to get this disseminated across the county. What does that look like? Will it be at clinics? Will it be at testing sites? Who's going to get the vaccine next? How will employers pay for the, how will employers work with their staff to give staff time off to get the vaccine? I don't know, there's just like a million vaccine stories, I think, to tell in the communities that are most important to serve, which are the communities that you write for and about.
Absolutely. I think we have a big role to play. Anna, can you also talk about dental health? Because I noticed that you mentioned it, but oftentimes this is not a covered benefit in many insurances, and et cetera.
Yeah.
How do you feel about that? What services do you offer?
Sure. So I don't know, have people been, I guess, I hate doing Zooms, like I'd love to just be in the room with you. Maybe you just raise your hand if you've been to, or type in yes, if you have been to one of the mass health, not fairs, what is it called? The one that used to be held at the Forum, that for all uninsured patients, they give free healthcare and free dental care, these mass health events. It's like a 3-day event. I'm sure many of you have covered it. Anyway, I know I used to cover it. And those events, as soon as the Affordable Care Act gave more people coverage, the people who were going to those events were looking for dental coverage because so many people do not have dental coverage. And even over the years, Medi-Cal, because of cost cutting, has had to cut back on dental services. Now that's been reinstated, a lot of the optional dental benefits, thank God. My Health LA has always covered dental. It's not at every clinic, because not every clinic has dental services, but many of our 52 agencies do have dental services. So if you're in My Health LA, you can get dental care for free. Everything in our program is free. Dental care, the mental health, all of it, the specialty care, if you need oncology services, urgent care, medications, it's all free to the participant. Of course, it's not a free program. It's a $65 million program, but thankfully we live in a county that supports this population. This would not and does not happen in Orange County or some of our other counties across the state.
Okay.
Also, Sandy asked a question. I'm sorry, real quick. Sandy asked a question about if we're going to see an uptick in mental health services during the holidays. So too bad Miriam's not here, because I'm sure she might have more to say about that. But in My Health LA and at the community clinics we partner with, we anticipate, yes, that people will be seeking mental health prevention services. Oh, Care Harbor. Thank you, Winnie. It's called Care Harbor, the event, the mass healthcare event. Anyway, people will be seeking, I think, more mental health support during the holidays. I personally just made the decision not to go see my mother in the Bay Area, and I'm a pretty upbeat person, and I have to say last night I was in tears telling my mom this. So, and I'm pretty upbeat. I can't imagine people who have also had losses in their families and are dealing with things even more serious than I, that to just think about the holidays and celebrating holidays without loved ones. So I do anticipate, and we hope people will take advantage of these services. We also know that there's been a huge spike in substance abuse disorder and opioid addictions during the pandemic. More opioid deaths, more addictions. So I mean, and it's really hard to deliver these services remotely. So we know that we hope that people will reach out to, in our program, to their clinics. And broadly speaking, we hope that people reach out to the Department of Public Health, who runs a lot of substance abuse programs across the county, for help during this time. So that would be another story. Like, to me, it's like, people have a lot of needs right now. There's the addiction rate is high, and how are people getting the care that they need? And one other little idea, I'm just going to throw it out there, is that our jails, they see a high number of people with substance abuse issues. They have actually recently started this year offering Narcan, which is the anti-overdose medication. If you overdose, you've probably heard of this, right? You can do the Narcan either in the nose or an injection. They've started handing out Narcan in a vending machine at the jail when people leave the jail.
Wow.
Yeah.
Well, I love that you're giving us, as a former journalist, you're giving us all these story ideas, right? And let's emphasize for our colleagues that you can help them tell the story of how My Health LA helps the community, right? By connecting them to clinics and maybe to patients, and they can do stories about it, because that's the only way sometimes people really get to hear about it. This is a program of last resort. This is a program that goes to people who have no other way of getting healthcare. So it's a very, very important program. There was a very interesting question in the chat. I don't know if anyone of the two of you can answer it, but someone was pointing out the families left behind by breadwinners who died through COVID-19. And is there any way, any program, anything that the county has, and you can talk about? I don't know if your particular departments have. Sherry or Anna?
So, Anna, if I may. So,
no, please.
For cash benefits, health benefits, nutrition benefits like CalFresh, depending on what resources, meaning property and all of that, the eligibility requirements are still in place. But I would still urge folks to contact us to find out. Don't assume that you're not eligible, because there are, for example, under the CalFresh program, there are property and resources that are exempt or not counted. in the eligibility determination. The same with Medi-Cal, the same with CalWorks, the cash benefits. Not the same for General Relief, which is a program for single adults, but don't assume. Call us. We're here. We'll answer any questions you may have. We don't do pre-screening to determine if you're eligible, but we will take your application over the phone. And in a lot of the cases, we're doing same day eligibility determinations and approvals. So you may get a same day notice.
Yeah, I would only add that I put something in the chat about 1 Degree, which is what I talked about before, our community resource platform that we use to connect people with resources. There are some financial resources available there for people to look at. And I would share too that, again, another story. During COVID, there have been so many new policies and programs and that for people who are suffering. Unfortunately, some of those are slated to come to an end at the end of this year, unless they are renewed. But things like eviction moratorium, Sherry could talk more about this from the DPSS perspective, but how people aren't getting cut off of Medi-Cal, right, during the time. It's the extended eligibility, like just tons of new policies. And because of COVID, our medical legal partnership, our partners with our lawyers that we work with in my program, they put on these seminars for our staff about these related to housing, food, financial assistance, benefits, and there was just like a list of all these new changes because of COVID. So people are able to get help more, I think, now than ever before. And thank goodness, because it's really needed.
Okay, great. Well, we have no more questions in the chat. Sandy, maybe you have one question. You always have a question.
Well, this has been tremendously helpful. I'd like you to please get in touch with San Francisco County and ask them why they aren't replicating this program. Truly, this is these 6 briefings have just been eye-opening. I have one final question to ask each of you. Every time there's a major epic event like the pandemic, one goes away with lessons learned. It may be too soon for that, but I would be curious if each of you, with your long experience in this work, has sort of had an insight about how the county can improve, what the county needs to do to meet this unprecedented crisis. If you could share a lesson learned with us, that would be a great finale to a wonderful briefing. Anna,
so
first and then.
Sure, I can jump in. But first, Sandy, there is a similar program to My Health LA in San Francisco. It's called Healthy San Francisco.
I know that. I'm talking about the communications.
Oh, gotcha. Oh, yes. Oh, I agree. This is so fantastic. What you guys are doing.
Talking about learning about who the people are behind the briefings that we can all use in the future. It's such a conundrum. Who do I call to find out this information? Well, now we've got this terrific source pool. So thank you. But before
Great. So this is my lesson, is that we should have known that the pandemic was going to impact populations in a very different way. We should have known in January, the minute we heard about COVID-19, that it was going to be a major health issue and that Black and brown populations were going to be impacted disproportionately, that deaths and illnesses and severe illnesses were going to be way more present and prevalent in those populations than in the Caucasian population. And I don't think that we truly understood that from day one. We do now, because the data has shown that if we had learned anything from any health issue that we have in our society, that we should have known that, and we should have acted, not just the county, hospitals, county legislators, the president, the governor, to address those disparities before they hit, to see if we could have mitigated them at all, because the disparities are stark. And I know you guys heard from my colleague, Dr. Flores Uribe, a few weeks ago, and she probably talked about some of this and some of the equity work we're doing, but it's devastating.
Thank you. And Ms. Cheatham.
So what I'll say is, what we've learned from this is that as a county, we're pretty flexible, and we pivoted very quickly in a way that allowed us to continue to serve, maybe not to the best that we could have, but we were able to continue to be there for the residents that need us. Can we get better? Yes. And we have learned and continue to learn. Even with this, I don't know if it's a second wave or a continued wave, but even now we're still learning more. And we take that and keep moving forward. And not to forget about our staff. As we make ourselves available to the public in different ways, we have to remember to take care of our teams.
Thank you. That's a word we can all, that's advice we can all absorb, whether we're working in the county or elsewhere. Thank you. Pilar, I'll give it back to you. This has been very informative.
Thank you. Just wanted to call attention to something in the chat that Daniel Sharp shared. The Central America Resource Center Carecen and Los Angeles County Office of Immigrant Affairs will be hosting a conversation with the immigrant community about staying safe during the holidays. This is very important because we like to get together with a lot of people, and we shouldn't this year. So that's going to be moderated by Univision reporter Norma Roque at 5 p.m. on Tuesday, December 22nd. Dr. Silvia Prieto from the Department of Public Health will answer community health questions and share important information. You have a link there to register for this Zoom if you like to cover it. And thank you to our media partners and our speakers for being with us in yet another news briefing. Thank you so much, and stay safe.
Thank